Madam Speaker, I rise today to share with you a powerful story from Beth Hunt in Longmont. Beth asked that I share her story on the floor of the House of Representatives to help put a human face on health care reform for my colleagues. Beth has a young family of 4. It's a 2-income household, but like a lot of 2-income households, they're still struggling to get by. Beth gets her insurance through her job, and they cover the 2 kids under her plan. Her husband is a self-employed handyman. He works very hard, and as anybody know who is a handyman or knows one, that can sometimes be a dangerous job. Beth can't cover her husband under her insurance because it was way too expensive. It would mean that her checks from her job would go 100% completely to insurance with nothing to spare. Why? Well, her husband has high blood pressure, and they applied with many independent insurance companies, but they all denied him. What are we supposed to do? Asked Beth. Every day I just hope that nothing happens to him, Beth says, because they can't afford it. Beth says, I love him so much and he deserves to have insurance. He works very hard at his job. Nobody's watching out for my husband. Nobody seems to care about us. Please help. Health care reform will help Beth and her family. And here's how. Depending on the income level of the family, they're a family of 4. If they make under $72,000 a year under the House plan, they will receive affordability credits to buy insurance. That's vouchers that they get that they'll be able to take to the insurance provider of their choice. Even if they make over $72,000, if they make $80,000 or $90,000, they will finally have a low-cost option for Beth's husband. What is that option? It's the exchange. The exchange is a pool of individuals and small businesses that buy insurance together, effectively giving individuals that are covered, like Beth's husband who's in business for himself, the same kind of buying power and negotiating leverage and buying insurance that multinational corporations with hundreds of thousands of employees have. So they'll be able to get that same favorable rate. Another thing we do is we prevent pricing discrimination and exclusions based on pre-existing conditions. So just because Beth's husband has high blood pressure doesn't mean he won't be able to be covered, and they no longer will be able to deny him. He will be able to get inexpensive insurance through the exchange without pricing discrimination based on his pre-existing condition. That will afford families like Beth real financial security. Healthcare reform will make families like Beth's and millions of other families across our country stronger. Stronger because they have some degree of healthcare security, some degree of financial security, and they can go to bed every night without worrying about what they're going to do if, God forbid, they have a medical emergency. Thank you, Madam Speaker.